Hello everyone, welcome to the video on GPAT 2022 crash course MCQ series. In this video, I am going to explain about previous GPAT pharmacology questions with answer explanation, and this is part 8. I have made already 7 parts from previous GPAT pharmacology questions, and this is my YouTube channel. If you like the video content, do share and subscribe the channel. Let's get into the topic. Now, which of the following is delayed type hypersensitivity reaction? Now, there are 4 types of hypersensitivity reactions are there. Now, type 1 is known as penicillin sensitive. This is because of allergy and it occurs immediately. Whereas type 2 is called as ABO incompatibility, which is also known as cytotoxic. When different blood groups are transfused, then this kind of incompatibility occurs, and this is very dangerous. It causes hemolysis. Whereas type 3 is known as Arthus reaction. It occurs because of immune complex formation. So in sometimes immune mediators will form a complex with antigen and antibody. That complex may cause hypersensitivity, that is known as Arthus reaction. Now, hypersensitivity that is related as delayed type of hypersensitivity belongs to type 4, and that is known as tuberculin sensitive or cell mediated hypersensitivity. So option C, delayed type of hypersensitivity, is nothing but tuberculin sensitive type 4 hypersensitivity reaction. Moving to the next one. Now, which of the following provides passive immunity to newborn baby? Now, we need to understand 2 things. See, two antibodies like IgG and IgA can confer passive immunity. Now, IgG is the only antibody which can cross through placenta. Now, when it can cross through placenta, the baby in the womb will get this antibody. But the question is about newborn baby. Newborn baby, from the breast milk, this IgA is secreted. So newborn baby, when mothers nurse their babies with their milk, the babies will get IgA antibody. So in case of a newborn, it is IgA. Understand the difference between IgG and IgA. IgA crosses through placenta. It is not with newborn. It is babies in the womb. Whereas for newborns, it is IgA which goes to the baby through the milk. So option C is the correct answer. Moving to the next one. Now, the time required to reach steady state after a dosage regimen depends on. The general theory says that it depends on T-halves or half-life. Usually around 5 half-lives it reaches a steady state. So option B, half-life of the drug, is responsible for steady state. Going to the next one. Now, which enzyme is used by HIV to form DNA in the host cell? See, the HIV, they are known as retroviruses. The reason why they are called as retroviruses is, in normal biological process, DNA prepares RNA. Whereas in case of retroviruses, RNA prepare a DNA. Because it is opposite to the normal process, they are known as retroviruses, and the process of DNA to RNA is known as transcription, whereas the opposite one is known as reverse transcription. So HIV makes its DNA from RNA, and the enzyme responsible for is reverse transcriptase. So option C is the correct one. Moving to the next one. Which of the following is not suitable as post-coital contraceptive? Now we need to understand the process of these contraceptives. In order to get contraception, progesterones, anti-progesterones, or a combination of progesterone and estrogen can be given. So this is what is the process for immediate contraception. So when you see not suitable, the question asks about which one of the following is not suitable. Now see, levonorgestrel is a progesterone derivative. So progesterones can be used, yes, they can be used for contraception. Ulipristal and mifepristone, both of them progesterone modulators, or they act as anti-progesterone. So anti-progesterone can also be used as contraceptives. Whereas mestranol is an ethinyl estradiol derivative. It is only estrogen derivative. Only estrogens cannot be used to cause contraception. So which of the following is not suitable means the apt answer is mestranol. It can be combined with progestins to bring about contraception, but alone it cannot be used. So answer is mestranol, option D. Now, which of the following increases systolic diastolic blood pressure in normal patient but not in patient with heart transplant? Now, what is happening in heart transplant is the autonomic nervous system neurons are cut during this heart transplantation. So all direct agents can act on receptors and show their action, whereas indirect actions, they cannot show their action because the autonomic neurons are cut and the stores of sympathomimetics are not there, like noradrenaline and adrenaline. So out of these, epinephrine, norepinephrine, phenylephrine, they will be directly acting on receptors, but tyramine is indirectly acting. It indirectly increases the release of stores of noradrenaline and adrenaline, and that stores are not there in heart transplant patient. So option C, tyramine, is the correct answer. Which of the following drug is considered as potassium sparing drug? See, diuretics like triamterene, amiloride are known as potassium sparing. The main purpose of potassium sparing diuretics is they retain potassium inside the body, because majority of diuretics will cause potassium loss that may affect cardiac health. So to avoid that, potassium sparing diuretics like triamterene and amiloride are used. So option A is correct one. Now, an antibiotic that resembles 3 end of a charged tRNA molecule is Puromycin. It is a protein synthesis inhibitor of bacteria, and how it will inhibit protein synthesis is the drug resembles 3 end of the charged tRNA and block the attachment of tRNA to ribosomes and mRNA. That is how it inhibits protein synthesis. So option C, Puromycin, is the correct answer. Now, which of the following drug causes less inhibition of REM sleep, rapid eye movement sleep? This is what causes a disturbed sleep, and Zolpidem is the answer. See, these kind of drugs are known as Z category drugs, like Zopiclone, Zolpidem, Zalplan. All these drugs are known as sleep inducers because they reduce this REM sleep and they are very effective in causing sleep. So Zolpidem is the answer here. Now, in Parkinson's disease, there is a predominant loss of dopaminergic neurons primarily in Parkinson's disease, the major neurons affected are nigrostriatal. Now, this nigro is because of substantia nigra and corpora striatum. There are neuronal connections between these two. Here, the neurotransmitter is dopamine, and this neuron degeneration is what reduces dopamine, and this pathway is responsible for mobility or movement. So this is what happens in Parkinson. So the major neuronal region affected is substantia nigra. So option A is the correct one. To the next one, match the following drugs with modes of action. Now look at them. Artemisinin, it generates oxygen and carbon free radicals. Pyrimethamine inhibits dihydrofolate reductase of malarial parasite. Now quinine inhibits parasites of heme polymerase. Atovaquone inhibits mitochondrial electron transport. So artemisinin, 1 goes with R. So only option is this one. 1 goes with R, 2 goes with S. Quinine, heme polymerase, and atovaquone inhibits mitochondrial electron transport. So option D is the correct one. See, this kind of multiple choice one, doing match the following is doing easy, because if you know any one thing correctly, then you can write, you will get the question correct. Going to the next one, the most effective agent to treat psychosis would be, now look at the agents. Buspirone is anti-anxiety. It is used to treat anxiety. Sertraline is SSR. This is selective serotonin reuptake inhibitor, which is used to treat depression. Now, amphetamine will cause a CNS activity. Look at the drug. See, this is used to treat depression. This may aggravate psychosis. Similarly, dextroamphetamine also may aggravate psychosis. Only choice of drug which is used to treat psychosis is olanzapine. This is an atypical antipsychotic, which has very much proven efficacy, and this is the choice of drug to treat psychosis. Going to the next one. Now, which of the following agents acts as hypoglycemic as ATP sensitive potassium channel blocker? When ATP sensitive potassium channel is blocked, calcium levels are increased, and this releases insulin. So these drugs will be acting as insulin secretogague, and Mitiglinide, Nadeglinide acts as this manner. Remaining drugs has got a different mechanism of action. So this is the choice of drug. Now, if a drug is highly plasma protein bound, what might be the consequence? Now think about sulfur drugs. Sulfur drugs are highly plasma bound. So when they are bound with this plasma, they are not available for their action. They will be bound with this plasma proteins. But there are some other drugs which can also bind with plasma proteins, like digoxin. When digoxin comes, it replaces sulfur drugs, and sulfur drug concentration increases in the blood. That may cause a different kind of interaction. Similarly, warfarin too. Warfarin also plasma protein bound. That will displace already present this plasma protein bound drug, and that increases the concentration. So what happens is, with this kind of drugs, it is a likely candidate for drug interaction. So option D is the correct answer. Now, what molecule feature is penicillin G said to be mimic? Now see, all the penicillins, their mechanism of action is they disrupt peptidoglycan. Now how do they do it? Peptidoglycan is made up of N-acetyl-muramic acid and N-acetyl-glucosamine. Now this N-acetyl-muramic acid has got certain amino acids like alanine, glycine, lysine, alanine and alanine. Now only the difference is the last two amino acids are D-configuration amino acid. Now usually in nature we found all the amino acids are of L configuration. Because it has got a D-configuration, it will evade peptide enzymes. Human beings has got peptide enzymes, but that cannot destroy this one because it is of different configuration. Now penicillin G, it mimics the structure of this alanine D configuration one. Because of this similarity, it will inhibit the cross-linking and inhibit transpeptidase enzyme. So it mimics the dipeptide moiety of D-alanine and alanine. Option D is the correct one. Next one. The resistance to macrolide antibiotic is developed by when macrolides are taken repeatedly, microorganism synthesizes an enzyme called esterase that will hydrolyze macrolide lactone. So this is how they will break down the macrolide drug and develops resistance. Now, which of the following phase 2 metabolism is associated with genetic polymorphism? Now, this one especially we see with isonicotinic acid hydroside. Now, INH will be metabolized in two types. In certain people, it is metabolized rapidly. They are known as fast estelators. In certain people, it will metabolize slowly. They are known as slow estelators. Because of this difference, this kind of difference is what is known as genetic polymorphism. And this is responsible for inter-individual variation for a drug. So certain people like fast estellator, the dose is not enough, it will be immediately metabolized. Whereas for slow estelators, the dose will be enough. And this especially occurs with acetylation. INH is metabolized by acetylation, and population there is a genetic polymorphism. Some people will metabolize it rapidly, some people will metabolize it slowly. So option B, acetylation, is the option here. Now, pregnancy test kits are designed to detect, this is already given and this is a repeated question. They detect human chorionic gonadotropin, HCG, which is present in urine in pregnant women. This is what the pregnancy test kits will detect. Now, which of the following statement is correct for gram-positive bacteria? Let us understand each and everything. See, cell wall has a thin peptidoglycan. No, gram-positive has got high amounts of peptidoglycan. Now, cell wall lipid content is low and they have small periplasm. This is true. The lipid content is high in gram-negative and large periplasm is there in gram-negative, whereas it is small and low lipid content in gram-positive. Let us see the remaining things too. Lipopolysaccharide layer is present? No, it is present in gram-negative. Teichoic acid is absent? No, it is present in gram-positive. So everything is ruled out. Only option is cell wall has got low lipid content and small periplasmic space. Now the next one. Which of the following is a side effect of ACE inhibitors? Now ACE inhibitors, the problem with this enzyme is it also metabolizes bradykinin and substance P. Both of them, bradykinin, substance P, metabolism is inhibited, so the levels are increased. When these levels are increased, they will cause cough because they are pro-inflammatory and they also release histamine. Both of them will cause cough. So what is the major adverse effect? Cough. So these are all the set of 20 previous GPAT questions of pharmacology. If you like the video, share the video and subscribe the channel. Thank you for watching this video.